welcome to Partners in Pain. My name is Susan Tupper and I'll be the facilitator for tonight's session. And thanks again for joining us. So before we begin, I wanted to acknowledge that we're all on treaty land, and land acknowledgements give us the opportunity to honor and express gratitude to the Indigenous people who live and work on this land now and have done so for many generations in the past. So I'm joining you from Saskatchewan, which is Treaty 6. I know we have other people from Treaty 4 down in the Regina and Yorkton areas. And in Treaty 6, these are the traditional lands of the Cree, Saulteaux, Dene, Dakota, Lakota, Nakota, and Métis nations. And I'm grateful for the privilege of living and working in this beautiful area and am constantly inspired by the vibrant Indigenous people who've been caretakers of this land for thousands of years. So just a bit of a background on Partners in Pain. This project grew out of the Improving Pain in Saskatchewan Collaborative Research Project. And we started this webinar series back in March of 2021, I believe. And we've been able to continue offering this webinar series thanks to a generous grant received from the Saskatchewan Community Initiatives Fund. And all of this work is supported by SAS Pain, a nonprofit organization that aims to help improve the lives of those living with pain in Saskatchewan. So just a little bit of webinar etiquette and a few reminders before I introduce Jackie, who's our first speaker. Please keep yourself muted while our presenter is speaking to minimize any background noise. And we're always happy to see your smiling faces or grumpy faces, whatever kind of face you want to make. So feel free to keep your video on. However, if you are having connection or bandwidth issues, turning the video off sometimes helps to keep the sound consistent. So there will be an opportunity to ask questions during the session. So make sure you submit your questions in the text box and I'll share them with our presenter. All right, so it is now my pleasure to be able to introduce our first speaker for the evening. Oh, Curtis says, I really thought I got that one. Oh, well, they're tough questions. Celine, you did a really good job of finding those. All right, so I will introduce our first speaker, Dr. Jackie Krushar. So Dr. Kraushaar is a Regina-based physiatrist who works at the Wascana Rehabilitation Center. She received her medical doctorate, MD degree at the University of Saskatchewan, and also went on to complete her residency in physical medicine and rehabilitation at the University of Saskatchewan. She is currently the Regina Area Department Lead for the Department of Physical Medicine and Rehabilitation. And she also has leadership roles in the College of Medicine as the Year 1 Regina Site Coordinator and Year 2 Chair. Dr. Kraushaar is very interested in medical education and is an assistant professor in the College of Medicine, teaching at both undergraduate and postgraduate levels. So thank you very much, Jackie, Dr. Kraushaar, for joining us this evening and for your presentation on neuropathic pain. We look forward to seeing that.
Thank you, and thank you for the kind introduction, Susan. I will share my screen so I can show my presentation and get started. There, hopefully everyone can see that okay. Okay, I have a thumbs up. Yeah, okay, perfect. So thank you for coming tonight to listen to me talk a little bit about neuropathic pain. As Susan mentioned, I work at Wascana Rehab Center as a rehab doctor there with a group of us. And so neuropathic pain is something that we see not uncommonly in our practice. And so hopefully I will be able to share some of my knowledge with you tonight on this important topic. Let me try to switch the slides as the first hard part. So just I put a conflict of interest declaration here, no conflict of interest to disclose. Sorry, I've been talking a long time today, so hopefully my voice holds out. So I wanted to make this very simple and just make two simple objectives that hopefully you can walk away with some tips and things like that from. So the first is to be able to identify what do symptoms of neuropathic pain look like, to get a sense if neuropathic pain is something that you may be experiencing, and then to learn a few ways to manage neuropathic pain symptoms, or at least know kind of what are some of the tools in our toolbox when we're looking at managing neuropathic pain. So the first important question to ask to really make sure that we understand kind of what we're all talking about is, what is neuropathic pain? And so neuropathic pain is really pain that is caused by actual or potential dysfunction or damage in the nervous system. And so when we're talking about the nervous system, I put some clues here in the pictures, but we're really talking about the brain, the spinal cord, so the spinal cord that runs through our spine, and then the nerves that come out of the spinal cord that send the signals and messages to various parts of our body. So the brain, spinal cord, and nerves, if there's pain that is generated or coming from dysfunction or damage there, is called neuropathic pain. Another important, I think, takeaway from this definition is that it's caused by actual or potential dysfunction. And so it doesn't have to be an actual injury or damage that can occur. It could be the potential for dysfunction. Pain is really, in a whole sense, supposed to be a protective feature. If we put our hand on a hot oven, it's supposed to say that hurts, remove your hand from the hot oven. And so it's supposed to have a protective property. Now we know that sometimes pain goes beyond that protective property and starts causing us troubles in ways that it no longer has that protective effect. And so sometimes there's actual damage that occurs to the nervous system, but sometimes it's just dysfunction or potential damage that might happen. The other thing is that pain is very complex, and I'll spend a couple of slides kind of talking a little bit about that as well too. But the severity of the pain is influenced by many things beyond the actual dysfunction or damage. And so, and oftentimes severity isn't necessarily correlate directly or doesn't link directly to how much damage there might be. And a simple kind of quick example of this is brain freeze. So I'm sure many of us have, you know, our first Slurpee of the summer, our first ice cap of the season now that it's getting nice out, and eagerly take that first big quick sip and immediately feel that pain behind our eyes or in our head or somewhere along there. And so there's not actual significant damage that's occurring, hopefully, from that ice cap that we're drinking quickly, but the sensory nerves in the roof of our mouth are saying, whoa, that was cold, and that was cold very fast. And they're sending pain signals, and they're kind of getting sent and referred to other parts of our head. And so it might feel very severe, but the actual damage or injury is not there. And so that's kind of an example of how it's not a perfect system in terms of showing you how much damage there might be. I think it's also helpful to kind of get a sense of what might cause neuropathic pain and have some idea. And so really it's any problem that might happen in those three areas: the brain, the spinal cord, or the nerves that come out of the spinal cord. And so examples in the brain are something like a stroke or an injury to your brain, like a brain injury following a trauma. Spinal cord can be spinal cord injury. It might be a tumor or some type of something pushing on the spinal cord and causing injury or damage. Nerve injuries can occur. That again can be trauma if you hurt your hand or something like that and you get nerve injury. It can also be something as simple as carpal tunnel syndrome. People who've experienced carpal tunnel syndrome, especially in the more severe cases, might describe that as a nerve type of pain. Complex regional pain syndrome is another that's classically described in terms of neuropathic pain symptoms. And then phantom pain. So phantom pain is if you've had an amputation of a limb, like an arm or a finger or a foot. And sometimes people describe pain in that part of the body that is no longer there because it's been amputated. That's a neuropathic pain type as well. And so that again shows that that part of the body is no longer there, but it's still causing pain. So pain is much more complex than just injury to that nerve itself. So how to kind of get a sense of if what you're feeling in terms of your pain symptoms might be nerve pain is that oftentimes the description of neuropathic pain has very specific qualities to it that we look for when we're looking for what people are describing. And so I put some pictures here just as little visual cues and aids, but really oftentimes it's described almost like an electrical feeling. So a shooting down into your arm or into your leg. It might be described as a zap. It might be described as a burning. So maybe like a hot burning feeling. Sometimes it's like a cold burning feeling. Numbness and tingling is often associated with it. And the numbness and tingling itself may not be painful. Sometimes it's just annoying. If your foot falls asleep and there's a numbness with it, sometimes it's just annoying and you can shake it out and that nerve just was compressed for a period of time. But if you've sat on that foot long enough and you put it down for the first time, that tingling and that numb feeling can be very painful. And so that again is an example of a neuropathic type of pain that in those situations is often, thankfully, quite short-lived. Hypersensitivity can occur too, and what hypersensitivity is things that are normally not painful. So light touch, like stroking your hand, or even like wind blowing on your arm or on your leg, or touching water, those kind of things that aren't normally painful can be described as painful. And so that's often like a hypersensitivity type of pain. And so neuropathic pain can be described as that sometimes as well. I put a couple slides in here just to, again, remind all of us that pain is very complex. And so how we experience pain is very individual to each one of us. And so there is the physical aspect of pain, the pain that we experience that's related to potentially some type of injury or some type of dysfunction, and that physical aspect of that. However, there's many more facets or areas of our pain that that kind of come together to create how everyone experiences pain on their very own unique ways. And so there's the emotional side of pain. So sometimes it's how you perceive the pain, how you feel about the pain, but also sometimes just how you're feeling in that moment when you have that pain, and how it might be exacerbated by some of the stress or emotional anxiety or things like that that you're feeling. There's the intellectual aspect of pain too, in terms of what is our knowledge of pain, what do we understand, what do we think about pain, and those kind of pieces as well. And then of course there's the spiritual aspect of pain. And so looking at it from one aspect doesn't necessarily give us that whole complete picture. And so we really have to look at it from many different areas. I also put in a quick little cycle here, just to give an example of how pain can happen and kind of cause or relate into more pain itself. And so here you have pain. So something happens. You might have nerve kind of pain related to diabetes in your foot. And so you might have kind of a pain in your foot related to that. And so what often happens, humans being humans, is we avoid the activities that cause that pain. And so we might not want to walk as much because it hurts to walk. We might not want to, put on our shoes and go outside because putting on our shoes and going outside is what is painful. So we often will avoid the activities that cause pain. Sometimes we even get a fear of movement that results from that. So we're avoiding those activities. Then we get worried about it. Like, how far do we have to walk at the grocery store? Is it going to hurt? Getting worried to even do those kind of things and get worried to move. What happens often then is that we get what we refer to as altered biomechanics. So we change the way we move. So if our foot is hurting, we might try to spend less time on that foot and limp and not put as much weight through that foot, or not put any weight through that foot. And so we change the way we move to try to avoid that painful area. And then what happens is that we get what's called deconditioning. So we're walking in a different way. The muscles that we're not using in that normal way anymore get weaker. And so if we try to start using them again in that normal way, say that injury or something resolves and we start trying to move a little bit more normally, we still get pain. And it's often because there's that weakness. Those muscles aren't used to being used in that same way anymore. And again, pain is not just a simple little cycle. So there's all these other overlaying aspects, our other life circumstances and experiences, anxiety and fear that we might experience related to the pain. If we have more of that avoidance kind of personality, that can sometimes contribute, and depression and fatigue. So there's lots of different aspects that can also contribute to how we experience pain. So moving on to kind of talking a little bit about how do we manage our pain symptoms. If we're having what we feel is neuropathic pain, what are the tools in our toolbox? And so I intentionally tried to make this look like a little box because it's our toolbox. And there's different things in our little toolbox that we can use when we're looking at how can we maybe manage our pain. And again, because everyone's pain experience is different, everyone's management for their pain symptoms will also be different as well. And so some of the broad categories are non-pharmacologic, so non-medication type of management options, which I'll go into in a second. Medications, there's interventions like injections, and then oftentimes more as a last resort, sometimes there's surgical options as well too. And so those are some of the things that are in our toolbox when we're looking at managing pain. I think one of the important things when we're talking to the approach to treatment, I already mentioned how important it is to be individualized to the person, but it's also multifaceted. So you're not just necessarily using medications. You want to use some of those tools in your toolbox, some of the non-medication strategies, all of those things when we're managing pain. So you want to look at it from different aspects and different areas and try to treat it kind of in some of those different ways. The other thing is you also look at active participation. And when I see patients who have pain in my clinic, I often tell them that it's important for them to be actively involved in their treatment program. And so some of that involves becoming educated on why they're having this pain, what is the reason. Sometimes knowing some of that helps with some of that anxiety and worry piece that we feel when we have the pain. And sometimes that can help manage some of our pain symptoms, but not all. But also active participation in terms of when I spoke about the pain cycle and how you might change the way you move and you might have kind of different weakness in different areas because of that. Actively participating in ways to, move, normalize our movements more, strengthen areas that might have become weak. Those kind of active pieces are very important. And so it's important for everyone to have an active role kind of in their treatment program. There are also what I refer to as passive things that we do for treatment for pain, which is not bad either. We'll use massage or acupuncture or different modalities to kind of treat our pain. And they're often very effective in different ways. But they sometimes have a more of a short-term effect to treat the pain in the moment and aren't necessarily changing some of those altered movements or some of that weakness or things like that that might help provide a bit more long-term pain relief. And so you have to kind of put both together when you're looking at a treatment plan. And then the last thing when looking at approach to how we treat our pain is that oftentimes when we're looking at neuropathic pain, so any pain coming from the brain, the spinal cord or nerves, oftentimes some of those injuries may be permanent. And so the injury to the spinal cord, the brain injury after a stroke, a nerve damage, some of that might be permanent. And so sometimes we are not able to take away that neuropathic pain completely or bring it down to a zero because that damage is there and we're not able to fix it per se. And so oftentimes our treatment really needs to be goal-based and look at what are we trying to achieve when we're looking at treatment options. And so kind of broad-based goals that are important often to consider are things like improving function. How can we improve function, being able to go to school, being able to go to work, being able to enjoy activities with family, whatever those are, to kind of being able to do some of your day-to-day activities like getting dressed or those kind of things. And so sometimes the goal-based is focused around function. And then the other is quality of life. And so things that we can do to help improve quality of life. So again, we might not be able to take the pain completely away, but hopefully there's strategies that we can do to help bring it down to a more manageable level. Looking at non-pharmacologic management, I just put a few broad categories here in terms of self-management. We already kind of talked about in terms of learning about your pain and what might be causing your pain, and especially if it's looking at a longer term dysfunction that might require longer term management, how to self-manage that is something that's important to learn. Desensitization is something we do quite commonly, more probably in phantom pain or nerve pain situations where the nerve becomes almost hypersensitive. And so we do like rubbing or tapping, or sometimes even like putting if it's your hand that's experiencing the pain, putting your hand in a container of rice or beans or things like that, just to get normal feelings and training the brain that those normal feelings are not to be interpreted as pain. Exercise is an important piece too. The most important part of exercise is something that you will stick to. So it really needs to be enjoyable. It needs to be easy to follow, convenient, budget friendly, all of those kind of things. So there's not necessarily one exercise program that outperforms the other. The one that's the better one is the one that you'll tend to do more. And sometimes it's just starting with increasing your activity level in general and increasing your walking during the day. Mindfulness activities, can be very important. There's lots of apps and programs and websites and things now dedicated to mindfulness that can be very helpful. Relaxation and imagery also falls into that. I kind of made a nice little beach picture here. It was cold when I was making this presentation, so that was the imagery that kind of spoke to me the most. TENS is using like electrical stimulation, like almost like a Dr. Hose machine, to help with pain management and cognitive behavioral therapy as well. This is just a quick little, we call it the 4 Ps of pain management, looking at the importance of pacing yourself. So not trying to do everything all at once in one day. Planning is on the far end here too, but planning your activities, planning kind of around important events and things. In that same stroke, prioritizing what needs to be done today, what are things that can maybe wait, and then positioning as well. So looking at things like your positioning in bed, your positioning when you're up in your chair, and those kind of things to help improve your comfort level. There's 2 resources I just thought I would put up here in terms of access through, this is through the SHA, the Live Well with Chronic Conditions, and you can see chronic pain is listed as one. And so you can call and they can offer some support and programs through the Live Well program. And one we often use in our clinic as well too is called the Online Therapy Unit, available for the University of Regina. That has a chronic health conditions course, and it is based on cognitive behavioral therapy, and it's kind of work at your own pace on the computer, which is kind of a nice option. I didn't want to go into too much detail because again, this would be really dependent on the person, but there are some medications that can be helpful, both what we call topical or things that you can apply to the skin that can sometimes help with nerve pain, and then oral medications, so pain medications you take by mouth. Oftentimes the most commonly used ones are anti-seizure or antidepressant type of medications that have been found to be helpful in treating neuropathic pain symptoms. Interventional procedures are not necessarily as commonly done and would be dependent on the person's diagnosis, but sometimes we can do things like nerve blocks if there's a specific nerve that's really causing some pain or problems. And then again, as a last option, surgery might be a consideration for some patients, looking at things like implanting spinal stimulators, which is again, often more of a last resort and something we would use in more specific cases. This is my second last slide, but just to say that we know that there are some strategies to help prevent chronic pain or help improve chronic pain symptoms in the long run as well too. And so this is just, again, not probably an exhaustive list by any means, but it's important to kind of continue as best we can with that healthy, active lifestyle with physical activity, quitting smoking if you smoke, getting a good diet, getting good sleep, having a primary health network, so a family physician or someone that you can regularly have checkups with, occupational health and safety in terms of ergonomic work setups and things like that can help with pain management. And then of course, mental health and addictions. So managing, again, that holistic approach to our pain symptoms. So in summary, neuropathic pain is common and can be due to many different reasons. And the treatment of neuropathic pain is multifactorial. So we have lots of different tools in our toolbox that we can use depending on the different type of pain and the pain experienced by that person. And really, I think the best strategy is if you're experiencing what you think might be neuropathic pain symptoms, please see your doctor for a full assessment and to discuss treatment options. And they can always refer you on if they feel that you need further evaluation as well. So those are all the slides I had today. Thank you for listening to me, and I hope that gave you a little bit of information about neuropathic pain that is helpful for you.
Thanks so much, Dr. Krushar. That was fantastic. A great overview of neuropathic pain and lots of great resources that you shared as well. So if anybody has questions, please make sure you put them into the chat and I can help facilitate that. And I see there is one there. Is there a type or location of nerve pain that responds better to topicals than other parts of the body? Great question.
Yeah. That's a great question. So it kind of depends on your diagnosis a little bit. For example, if you do have like a nerve related pain that's in the hand or related to a nerve injury or maybe carpal tunnel that's very severe or something like that, When you apply topical medications, it can diffuse better if it's like in small areas, like small areas of the hand or just a patch of skin somewhere that's causing some trouble. And so usually it's more related to nerve type of pain that is not necessarily the brain or spinal cord injury pain, but more that nerve pain that's kind of out in the periphery. That being said, there are some topical medications, or not even necessarily medications, but topical creams like capsaicin, which is basically like hot pepper kind of cream that they apply. And it basically, my idea of it is that it causes almost like a distraction piece where you apply this other topical that might give heating or cooling properties or things like that. And it might kind of, again, help the brain to realize that what they're feeling in that area isn't necessarily painful. And so if it is like something like that, where you're using a topical like that, that might work in different ways as well. I hope that answers your question.
Great, thank you. All right, another question, and some kudos and thanks and great presentation comments as well. So Colleen asks, would you please give an example of spiritual pain?
Yeah, and I think when I intended to talk about the pain experience, it's not necessarily like for me, I'm definitely not an expert in terms of the spiritual pain aspect of things, but it's more related to that whole approach of how we feel pain or how we interpret pain or how we think about pain. And so different aspects of a person's spirituality will affect how we approach, how we feel about the pain, how we might consider treating it, all of those kind of pieces. And so it's not necessarily the spiritual aspect that's causing the pain, but it's more that kind of us as a person and who we are in terms of our spiritual sense, how we will feel that pain or experience that pain might be different.
Great, thank you. All right, make sure you put your questions in. We have a couple more minutes for questions. And while we're waiting for other people, I have a question. Just related to people who've had long-standing neuropathic pain, say, for example, a crush injury to a nerve, and they have had pain that has not really responded well to treatments, to medications or injections for at least 5 years. What kind of advice would you have for that person of who they should see or what kind of help they should seek at that point?
Yeah, those ones are very difficult to treat because those type of nerve pain almost becomes like there is a part that there are studies that show with chronic pain over time, our body responds differently to the sensations we feel and we become almost hyper aware of those sensations and so your brain kind of chemistry changes when you have chronic pain for a long time too. And so oftentimes I will start with looking at that kind of cognitive behavioral therapy part to start with when we're looking at a more long-term chronic pain, just because it's similar to phantom pain. We know people who've had an amputation, for example, if they had a lot of pain in that limb before the amputation, they're more prone to having phantom pain. Whereas if it was a trauma and they didn't have pain before, and they're less prone, not necessarily zero. And so that chronicity of it can kind of exacerbate those pain symptoms. So I would definitely want to start with things like making sure we're treating it from all different angles, including the cognitive behavioral therapy aspect, looking at kind of sleep and diet and all those kind of pieces, and optimizing medications as best we can. But sometimes in those situations, it is looking more at those surgical options. Is there more, different kinds of injections, nerve blocks or things like that? Is there any stimulators or things like that that might help? But it's really looking at kind of trying all the other options typically first and seeing what might work, and really looking at that. And yeah, rhizotomy may be an example of a surgical treatment as well that you might consider. So there are different surgical options that, again, in long-term, more chronic situations, you might be open to exploring. And definitely the surgical aspect is not necessarily my area of expertise. It would be having that discussion with a surgeon around the potential benefits of those options.
Great. Another question, seeing as there's no more in the chat right now, can you give some advice on when somebody should seek care from a physiatrist as opposed to a neurologist or or some other type of physician specialist? And I know this is probably a political question, but go ahead.
It was an interesting question. It kind of depends a little bit on where you are too. Like certainly different physicians. So neuropathic pain can be treated by your primary care physician as a first line option, but certainly in more complex situations or cases, they may want to refer on to a specialist, which is completely appropriate. The question of when is it a neurologist versus when is it a physiatrist versus when is it is a little bit more challenging, because definitely it's related to a little bit of your area of where you live, because certainly different physicians, all of those physicians have expertise in treating neuropathic pain, but it will depend how many of those physicians are in that area, who's available, those kind of things. So your family physician hopefully would be the most appropriate to kind of help lead you in that direction. Certainly from my experience in physiatry, our goal is very much that return to function, improving quality of life. Those are kind of the key aspects for our specialty that we really want to focus on. And so looking at kind of those things from all the different angles in terms of work and school and you know, social activities and those kind of things are things that we definitely take into consideration as best as we can when we're looking at treating complex pain. And so if that's something that you feel that you might need, that's definitely a potential as well. Sometimes you need nerve tests as well, like EMG or nerve conduction study tests to see if there is a nerve injury. And certainly neurologists and physiatrists can both do those tests too. So I guess it's a little bit of a, it depends. And I think both definitely have positive like benefits of seeing either of those specialties to looking at nerve pain options.
Great, thank you.
Hey, Dr. Jackie, can I say something?
Of course.
Tom here. I've been diagnosed with neurology 5.5 years ago, and I've tried many different things, and I still haven't got it resolved. And you did cover a lot of it, what you're talking about, but like surgery is out, nerve block did not help me. Medication, no. And I just can't resolve this. So I don't know what to do.
Mm-hmm.
You did cover a lot of it, but just ask it.
Yeah, and that's very difficult. And certainly that's why I went into a little bit about oftentimes we can't resolve it completely, and we might not even necessarily know completely what the underlying cause is completely related to. And so it's looking at what are the strategies or things that we can do to try to improve comfort in different ways, whether that be improving sleep, improving positioning so you have comfort in different ways, increasing activity. It's little day-to-day things we can do to see if we can improve. The 4 Ps become important, because if we can't make the pain go away completely by trying our various different methods, then we have to look at pacing and prioritizing and planning as a way of making sure that you're able to do those things that are meaningful and important to you in a day, and maybe not necessarily focusing on some of those other things that aren't as important when your pain is more significant. So I don't have a you know, specific answer on what it could be. Certainly if you haven't had a full assessment or been referred, you know, for specialist assessment, that could be something that you might want to talk with your family physician about as well.
Great. All right, thanks for that answer. So there's one more question and then we'll move on to Dayna's session. So Gail asked, does a nerve block provide long-term relief or for a short time?
It kind of depends. Again, nerve blocks, it depends on what the medications they use. Oftentimes, if we're doing a trial, I don't do them. So again, I might not be the most appropriate to speak to nerve blocks specifically, but if you're doing a nerve block, you use different medications. And so you'd first use like a short acting type of medication to see if it even is going to work as a first line option, but it would depend on the medications that they're injecting. But that's a very good question.
All right. That's great. And thanks everybody for your questions. And thanks so much again, Dr. Krushar, for your excellent presentation and information about neuropathic pain. Thank you.
Thank you, everyone.
All right. So we will move on now to our second speaker for the evening, and that is Dayna. Dayna Fesciuc is a 48-year-old artist, writer, and photographer who's been using art therapy as a way to manage her chronic pain. Dayna says art therapy has made a measurable difference in her pain and has been a game changer with helping her get her life back. All right, and we have a pre-recorded video of Dayna doing an art therapy session. And so over to you, Celine.
Hey guys, it's Dayna. I'm back to teach you art therapy session number 4 today. And so I'm going to run through our supplies. And the first thing that we're going to be using today is an old picture frame. Okay, nothing in it. Absolutely nothing through there. Just me. And then we're going to use a sanding block or just even a piece of sanding paper. And then we're going to use some painter's tape is so that we can set up which parts of the frame we may want different colors. And then we're going to use twine. This is $1.50 at the dollar store. You can use any type of twine will do. A picture hanging kit, and I'll explain that as we go. There's only a couple items we'll use from that. And then I've got a little notions bag of tiny little clothespins, and I'll show you what we're going to do. Hold on. Hey guys, the first thing that we're going to do is, because I got this frame actually it was donated to me, because that's how I get a lot of my workable items, because I really try to budget for art as best as I can. I had this donated to me. So the very first thing we're going to do is just simply using a wet paper towel or a wet cloth. You want to wipe it down and get anything off of the frame that might have pre-existed there, lived on that, whatever the case may be. Okay, so we're just going to do a quick wipe down, making sure that you are being careful for anything that might have been on the frame before that was a staple or anything that you could potentially hurt yourself on. You do not want that happening. So just be really cautious with that. Okay, and so yeah, quick wipe down, and you want to wipe it down on all areas. See, there's a sharp part. So you just want to make sure that you're very cautious around that. I don't want you guys getting hurt in the making of this therapy session. And why, you might ask, am I doing something like this instead of painting? Because it's a little bit more involved, but you're still able to see where you can do something really neat that is an art project. It might not be painting. Well, it is. We're going to paint the frame. But what it is it's, again, that distraction method that we always talk about with regard to focusing away from our pain. So this is just as well to keep your focus, especially when you're doing something that is outside of maybe what your normal is. That's something that you've never done before. So, okay, so at this point, I believe I've wiped it down fully, all the way around, making sure any, nasties are off of it. Then I'm just gonna throw that there to the side for later. Next step is I'm going to lightly sand and then wipe it down again. So for that, you don't need to watch, but I will give you a little bit of demonstration, then I'll come back and show you the next step. So basically what you're doing with your sanding block is just making sure that there is no roughness that, again, is sticking up or is gonna, if you run your fingers over, it's gonna hurt you. So you're just, again, now that we've done a quick wipe, we're gonna do a quick sand. It also, depending on the frame, if the frame is something that is like glossy, then it's not gonna take paint. So you're gonna need to rough that up a little bit. So just quick run over it. We'll get any little sharp, any little slivers, anything off the frame that is not something that you want there, as well as it's, again, giving it that kind of, you can see here what it does. It dulls it, and it gives it a bit of tooth or grain lifted so that it can pick up the paint, any paint that you would put on, okay? You still are gonna wanna prime this though, which I will show you what we're gonna do with that, okay? So just giving it that quick little sanding job. And again, I'm not putting a lot of pressure, so this is not hard on my arms or hands. You guys can do this. It might not be something you thought you could do, but you can, okay? So I'm gonna finish sanding, and then I'm gonna come back and show you what the next step is. Hey guys, I'm back for a quick second to show you, this is why we want to wipe things down that we get donated or brought into our homes, because that's disgusting. And that was all over this frame. That was partly the sanding, but not all. That was before I did the sanding as well. And then I did the sanding, and then I did a light wipe down again. So you want to make sure that you do that before you get really deep into any project, because you're bringing this into your home. You want to make sure that it's a good quality item when you're done, and make sure that that is not following throughout your home. So glad I did that. Next step is I'm going to take craft paint, just basic white, and I'm going to prime this, and then I'm going to bring a color on top of it. You guys know me, it's probably going to be a bright, shocking color, because that's what I prefer in my place because of my depression. I like everything light, bright, shocking, bold colors, and things that are going to make me happy. So I'm going to do that next with this frame. I'm using just a regular paintbrush. I'll show you. Just a regular, like, painting artist brush to paint this frame. You could use a bigger brush if you wanted to do this faster. I'm going to take my time and really get in the nooks and crannies of this, and then I'll come back and show you what it looks like totally painted, and then what our next step is going to be. Hold on. Guys, I've popped back on to give you a couple quick tips. So the white paint that I use is basic crafter's paint, and it's all-purpose acrylic, and the reason I use this is because it is non-toxic, lead-free, has a bit of an odor to it, so better if you have a window open if you're doing a huge project, because it would overwhelm you if you're doing a huge project. I have in fact primed entire cabinets with this, so it is, I mean, because for $1.50, you're going to get a lot better value and a lot further stretch of your money. You can mix this with water and do a wash as a primer, so it actually really works well. And then your crafter's paints adhere very well to it. This is adhering very well, this lime paint. Another tip I want to give you is that if you're working on something and you've got to get to the edges, you can use things like painter's tape or masking tape or something just to lift the edge and give yourself the ability to just paint on that edge without it being where you've got to really get your hands constantly under your project. So just a couple little tips. I'll be right back. Guys, I'm back again. I'm just finishing up the framework in the lime green that I've chosen, Lime Tree. And this paint, again, I want to talk to you about because, again, it's an all-purpose craft acrylic. It's Lime Tree. I really love this shade. It really pops. It's really fun. It's really bright. It makes my heart go pitter-patter. I just love it. Makes my soul happy, and it makes me smile. So that does a lot for a less than $2 paint. With all the changes that I like to do on a constant basis in my home, because of my manic depression, I really like constant change in my suite. So that being the case, it's expensive to do changes of any kind, as you guys well know, in any home things that you want to do. So I find the cheapest possible ways. I can tell you with a lot, like 20 plus years experience, that these paints that I'm using to do this are going to last an extremely long time. And in fact, these little guys, this is a 2-ounce paint. This one here is a 4-ounce paint. These guys can do whole cabinets, can do bookshelves, can do dressers, can do all the same things that an actual house paint would do. So the only question that you might have is, does it last? Can it cure? Well, it can, it will. All you have to do is give it a certain amount of time. Now, albeit it will take a little bit longer to cure than your regular house paint if you're painting it. But by far, for less than $1.50 for this little guy and $1.50 only for this big guy, maybe $1.80 at some expensive places, oh, this big guy, you can do whole cabinets with this amount of paint. I've done an entire bookshelf with less than $3 of lime tree paint. So I'm just saying, it's an option. And if you're crafty like I am and always wanting that change and always wanting to work on your environment like that, keep it a happy place and a vibrant place, you can do that on the cheap by using products like this that do very well, hold up very well. I keep my place extremely warm because of my chronic illnesses. And this paint holds up extremely well in warm temperatures, like really warm temperatures in the house. They stand up to cold temperatures. They're very, very good. They are, though, an inside one. You can't use these outside. That's not a great place for them. They won't hold up anywhere near as well out there as they do indoors. So I just wanted to give you a heads up on that because, like I said, if you're anything like me and you like constant change to bring your moods up and keep your depression at bay or keep cabin fever away in the winter or whatever, I change my place out all the time, from paintings on the walls to cabinets to tabletops to repurposing and redoing chairs to whatever. As long as it makes me happy, it's worthwhile doing. But I also am very wary always of my budget when I'm doing it. So it just gives you a few tips to adequately work with there. Okay, this is almost done of being painted. I'm going to come back when it's dry and I'll show you the next steps. Bye. Hey guys, I'm back. So the next step is this. I took that twine that I showed you earlier and I opened it up and I pulled off enough. It's hard to see it here because it's really thin, but here, I'll come right close. Okay, there. So I pulled off enough to do 3 strands across. So basically, if you haven't figured out what we're doing yet, it's a message center or a picture holder, picture frame. You can put, even if it's just a frame, you can still load pictures in it just by putting some twine across and creating a message center that you can just clip your pictures to. So this is great for my studio. It works the way to kitchen for recipes on a wall. It works for hanging pictures from your kids. It's great of a thing to do if you've got kids and they like to do art and like that, rather than wrecking the walls repeatedly. You can put a string across and clip their artwork to it and change it out as often as you want with your kids. It's a great project to do with your kids if you've got kids. And for anyone like me that is single without kids, then it's just a great project to have, like I said, for my studio, for a message board. I will keep all my contract jobs on here, or up and coming art therapy sessions that I'm filming for, anything like that. So I cut 3 pieces because that's what I want on here, is 3 of them going across to hold messages. And there's the 3rd. And now what I'm doing is I've gone into that picture hanging kit and I'm looking for, there is wire. I could have used wire, and you can use wire if that's what you prefer. I wanted color, so I picked this. I actually originally picked this cord, but it's way too thick and it won't go through the little eyelets that I'm going to use. So I've got the little eyelets here from the picture frame. These cords will easily go through that and tie to it. So that's all I'm going to do, is I'm going to take these little eyelets, and there aren't any pre-drilled holes. So I'm going to do a test one and see if I can just turn it in with my fingers. If I can't, then I'll have to pull out my drill or tap a little nail in, finishing nail, just to start the hole, and then you'd be able to turn these in. But I'm fairly confident these are so small and the picture frame is not a tough thing. So we'll see whether or not this works. And it feels like it's going into the wood. This will take a minute or 2 to turn it in. It's small. You can use bigger ones. It's just what I had in the kit. Oh, so I started the hole and it fell right out. So, trial and error. Trial and error. That was an error. Okay, so now after you've got these started in and you've got them all in, so you can do, for my case, because I want to have 3 lines, I'm going to put 6 of these guys in. So I'm not going to bore you with getting these in on camera. It is going to take me a bit of time here to turn these because my wrists are sore. So I will do this in my own time, but I'll show you the next step, which is once I've got these in, I will string the cords across and then I'll turn it around and I'll show you what it looks like with the clips on it and on the lines of holding pictures, and you can see what I meant and how it looks. Hold on. Hey guys, okay, so you see me struggling with that first one, so I wanted to come back and make sure that you guys seen me do a couple so that you do know that it is easy and you can do it. You just gotta kind of be resourceful. I can't for the life of me find my hammer, so I've got a butter knife and the thick end of it is what I'm using as a hammer. I have a little finishing nail here and I'm literally just tapping it in to get a bit of a hole started in the board, and then I pull that out and I take my little eye hook, I start it in that little hole, and then it goes just fine, and I'm able to get it quick and easy into the frame. Once it's started, it's just fine to keep turning it to get it the rest of the way in. So it truly is that easy, and you can do it. I've got 5 of the 6 that I wanted in. So I'm going to do the other one, and now that I've showed you this one works so easily, I'm going to do this last one here, and then I'm going to show you it with the cords put on it so that you can see what I did there. All I'm going to be doing is tying them to these little eye hooks, and then I'm going to, right now I'm using this nail as leverage just to push this around, turn it, there we go, last turn. Okay, and then I'm going to get the last one in here. Then I'm going to use those strings that I cut earlier, the twine. I'm going to run them between here, and I'm going to make them taut so that, and cut any extra off so that's not hanging and looking awful on the back. I'm going to make it tight, do knots both sides, and make it taut enough so that when I've got pictures or recipe cards hanging, it's not going to dip those cords down. Okay, so I'm just going to finish up on this, and then I'll come back with the cords. Okay guys, so here we go. So here is my version of this. So I've done 3 rows. Now I'm going to show you my mistakes deliberately so you don't make the same. But okay, so here's my eyelets on the back, okay? Right here, here, and here. So my first one that I tied on, I thought it was tight enough, but you can tell it's kind of loosey-goosey. My second one I tied on better. My third one went a little bit loose as well. I think it's because the twine that I used has a bit of a stretch to it. So just be aware of that for yourselves. I'll probably go back because I've got a lot of twine. I'll probably cut this off and just make it tighter and do a different one on it. These are the little tiny, aren't they the sweetest little things? They are the tiniest little clothespins that you've ever seen in your life. Okay, see it there? They're the tiniest little, I got a bag of them for like $1 at the dollar store, and there was 100 of them in there. So again, the costs are very, very limited. This is perfect for hanging pictures or notes on. I've got a bunch of them already ready on the line. And I've just clipped the note here. This one says Art Therapy March 2022. So this project now, when you look at it, it was a donated frame. The twine was $1.50. These little clothespins I've had for years, but let's count it as money in. So $1 there. So that's $2.50 with a donated frame. And this little picture frame kit was also $1. So for, oh my God, my math is so bad. What did I just say? $1, that's 2, and $1.50. $3.50 for $3.50. And then I had the craft paint, but let's cost it in there. $3.50, $1.50 or $1. This guy was 97 cents. So $1, so that's $4.50. And I used some of the white, which clearly I've got lots left of both, so I didn't go through them. This guy was $1.50. So we're talking still under a $10 project that you can now have sit anywhere in your home. If you do these lines as tight as you should do them, it will support these little notes. You can put, if you do them tight enough, they will support file cards. And this is now a perfect project that for me, even though the lines are a little bit slack, once I get them a little tighter, I'm going to take this, I'm going to put it up on my bright orange walls in my studio. And this is going to show me dates and times and things that I need to get stuff done. So this is really important to me. You could also, like I said, this is great for kids to hang their artwork in, hang photos, just regular photos across, to keep handy, any memories, grocery store list, pretty much anything you can put in the frame. So again, the things to learn from my mistakes are make sure these lines are really tight to hold the work. And when you're putting your eyelets in, your little hooks in, to make sure that you do a little pre-hole of either just a tap in like I did with the finishing nail first and then screw them in, or then use an actual hammer and tap in either finishing nails or something that you can bend over on the sides here that they're not seen. So this is the project, and I know I always sign my work, and you know what? I'm still going to do that. I'm going to do it on the back here where it's not seen. But for me, I will know this was mine. I took the time, I took the energy, and I had a lot of fun actually doing this. This was a lot of fun for me. The painting, the sanding, it didn't take a lot of time, a lot of effort, but it was a lot of fun, and it gave me a finished product that I can actively use. It took my mind off the pain. It's bright colored. It's going to look fabulous in my place. And again, it was something that I could show you that is simple and easy to do. You could, if you didn't have the eyelets or finishing nails, could you have tied twine right to the frame itself? Absolutely. If you wanted to, instead of these, you could have on the back there, you could have used just a gun. Standing it on its edge, you could have stapled the cord right to it in those 3 places. You could run just 2 cords if you didn't want it to, like on mine, something on the bottom here, it's going to probably overhang the frame. If you don't want that, then just put 2 strings in. You'll still fit about, this is about a 4x6, like a picture. So you'd fit about 6 pictures in there that you can change out of family or friends or whatever, special occasions. It's just a fun project to do that is super easy, super simple, doesn't cost a lot. And today it kept me away from my pain. And I was able to share that with you. So I'm so grateful. Thank you all so much for watching and being with me today. I'm so very grateful for all of you. I hope this was a fun project for you. And I promise we'll get back to art therapy. And I think maybe the next one I do might be oil pastels or something like that. But I wanted to throw one of these in so that you could see, yes, you can do something like this for inexpensive, fun, and something of a project that you can actively use. Anyway, thanks again for being with me. Bye.
Thanks so much, Dayna. That was fantastic as always. And yeah, I'm reading the comments in the chat box of love the green color and great idea, very functional and always lots of fun. So thanks again so much, Dayna, for sharing your art therapy session with us. And I always enjoy watching those and your enthusiasm for what you do and making it seem so simple. And you do share these projects that I think are quite easy for other people to replicate. So thanks again for that. So I just wanted to express thank yous again to Dr. Krushar and to Dayna again for their sharing their information and their ideas with us and their expertise. So big thank yous to both of you for being here and for helping us make Partners in Pain such a great event. And so just some final comments before we wrap up here. The recordings of the webinars are on the SAS Pain YouTube channel. So you can just search on YouTube, you can search for SAS Pain and you'll see all of our previous recordings. And this one will be posted again once we finish the formatting for it, which should be within the week. And we'll be sending out an email to all of our participants tomorrow. And please fill in our evaluation and let us know what you think of the session and any ideas for future sessions as well. We're looking forward to getting your feedback on that. So our next webinar is in 2 weeks. We will hear at 6:30 p.m. again on another Tuesday evening. We will be hearing about headache and migraine from Dr. Paul Matowski. And we also have someone sharing their story of their lived experience with pain. And we have an activity session on gardening, very timely. It's a good time to be putting our garden in, so we'll learn all about that on June 7th with Hilary Stamatinos. So please make sure you share information about the webinar with your friends and family, colleagues, people you meet on the street. Let them know that we're doing Partners in Pain, that anyone is welcome to join us. And thank you again, everybody, for joining us this evening. And please go out and enjoy some of the nice weather that we're having. And thanks again to the Saskatchewan Communities Initiative Fund for funding this, and also to SAS Pain for hosting it. Thanks again, everyone.